show you how to do the anterior approach for the ground to wheelchair transfer. So with this, you're going to be using this to get up after completing your gym exercise program or after playing with kids. This is also a way to get patients back into their wheelchair after they're bumping up and down the steps. So with this, things that might affect whether or not they're successful with it is if they have tight hip flexors, as well as if they have a TLSO or any other brace that restricts their motion, as well as decreased head-hips relationship or decreased upper extremity strength. Things that you would not want to continue with this is if they have significant wounds, getting down and up off of the floor isn't the best for those, as well as weight-bearing precautions. And if they have a higher level cervical lesion, again, this is going to be more of a dependent transfer for those patients. So when completing the skill, what you're going to have the patient do is scoot over next to the wheelchair. Once they're here, they're going to manipulate their legs so that their knees are up right in front of the wheelchair, and their feet are going to be on top of one another so that when they transfer, they come into a tall kneeling position. Next, they're going to have their hand that they're pushing up with as close to their body as possible, and their other hand is going to sit either on the cushion, or if there's a frame armrest, they can grab onto that. The next thing is the head-hips relationship. They're going to drive their head down towards the ground and then tuck it in underneath their armpit to help launch them into the chair. One of the things that's really important is momentum with this, so it should be a quick motion. So here it goes. So once they're up into tall kneeling, they can rest here and use their body weight to stabilize them in the chair. The next part is a depression lift where they're going to come up and then using the head-hips relationship, swivel in the chair to land their butt onto the seat. And so once they're here, they're stable again, they're not going to fall. They can finish off the rotation and come into sitting. The things that are most important, as I said, are the head-hips relationship as well as upper extremity strength and the momentum to get them up and into the wheelchair.